Good evening, dear viewers, and good evening, Dr. Fatima.
Good evening, Abdullah, and welcome to another episode of Medical Talk, the program that brings you trusted medical knowledge to help you and your families live better and healthier lives.
So, dear viewers, children health concern can often become stressful for parents, especially when symptoms involve breathing difficulties, choking episodes, or recovery after surgery.
Many parents today have questions about tonsils and adenoid surgeries, ear tube procedures, and warning signs like noisy breathing in babies or choking in newborns.
And while some symptoms may appear simple, others may require immediate medical attention and proper follow-up care.
So to help us better understand these important pediatric ear, nose, and throat concerns, we are pleased to welcome Dr. Abeer Alali, specialist in ENT and head and neck surgery with fellowship training in pediatric ENT.
So stay with us. I'm Abdullah Al-Ajmi.
And I'm Dr. Fatma Al-Ansari, and you are watching Medical Talk. Hello, dear viewers, and welcome again. With us today is Dr. Abeer Alali, ENT pediatric specialist. Hello, Dr. Abeer. Welcome to our show.
Hello. Thank you for having me.
Welcome to the show, Doctor.
Thank you so much.
So, Dr. Abeer, let's start the discussion with tonsillectomy. What are the most important post-operation instructions that parents should follow after the procedure?
I think this is a very good question because the procedure itself, adenotonsillectomy, is fairly a straightforward, simple procedure. But I always say that the post-op care is the critical part of it. It's that how to take care of the patients and children after the procedure. So we know that the procedure is located in the throat. And I always mention that it's like an exposed wound. There's no Band-Aid on it, there's nothing. And it's a passage where you swallow the saliva, you cough, you cry, you strain. It always occurs in the throat.
So that's
why it is a sensitive area, and that's why I always say that we have to keep in mind that it's going to be painful, because if the kid cries or screams or coughs, it's painful. So we have to keep in mind that the first thing that we need to make sure is that the kid is well taken care of in terms of pain management. They have to be on good painkillers. The other thing is, because it is a fresh wound and it's not covered, as we said, with any kind of dressing, so we have to make sure that the food that they eat post-op is usually soft in texture, so that it doesn't cause any scarring, or not scarring, that does not affect the wound or causes any kind of
inflammation,
irritation, let's say is the word. And the other thing is that we have to make sure that the patient is well relaxed, occupied, because what is worse than the pain itself is the memory of pain. Because when the kids, even sometimes I've seen a lot of kids that even after the pain is gone, they still remember the pain.
Like
so they have
maybe
fear, and they have like sort of post-trauma experience. So that's why I always say keep them happy, keep them well occupied, so that they could have hopefully a better experience with the surgery afterwards.
So Dr. Abeer, what symptoms after the surgery is considered normal, and what are the warning signs that parents should look out for?
So the first sign that we need to make sure of, or do you want the normal symptoms that occur post-op?
Yes, please.
So it's normal to have pain, as we said, but we don't want it to be severe pain to the point where the kid cannot function or cannot eat.
Yes.
So we have to make sure that the pain is well managed. So if the pain is severe, that's an alarming sign. I don't want it to be severe where the kid stops eating.
Yes.
The other thing is, it is normal after surgery to have a low-grade fever. It's with any surgery, but it's not normal to have high-grade surgery that lasts, high-grade fever that lasts more than 48 hours. I would also ask the parents to come and consult the surgeon to make sure that everything is okay and that there's no secondary infection. The other thing is that is not normal and that we have to be very, very careful of is that bleeding. I should not see any drop of blood from the mouth after the surgery.
Okay.
Even a tiny drop of real fresh blood, I ask the parents to come immediately to the ER.
You mentioned, Dr. Abeer, pain with the children. Do you use the pain scale with them to assess their pain? How do you ask them? How do you know if it's exaggerated pain or if it's normal pain?
That's a good question. Personally, I cannot do that because the kids most of the time, I mean, they're at home.
Yes.
Usually they leave they're discharged from the hospital, most of them on the day of surgery because it's a day surgery.
Okay.
And in worst case scenarios, could be like 2 days or 1 day after surgery. So most of the time the kids are actually at home. So I cannot assess that, but I do explain to the parents that severe pain would be when the patient refuses to eat. That means that the child is in severe pain. So, that's why I always make sure that they're covered with pain around the clock, or with pain treatment around the clock, so they don't reach that point where they have severe pain and they cannot eat. And if they don't eat, it means that they get into dehydration.
Definitely.
Dr. Abeer, many parents worry about their children, especially during the recovery period when eating or drinking. What do you think should be the safest approach during recovery?
Again, it's to control the pain and respect the doctor's recommendation in post-op feeding. So let's say I usually give, and again, I have to say, there's no written guideline on what to give to eat after surgery, but I feel that is very helpful when we, especially in the first 48 hours, we allow the child to eat whatever they want, but it has to be cold and soft.
Okay.
So I do emphasize that it has to be cold for the first 48 hours. And after that, we can start gradually introducing normal diet with normal temperatures. However, we need to keep in mind that it has to be of texture that is just to respect that there's a fresh wound in the throat. I'm not asking the parents to give them baby food or any purees, because there are certain ages where they don't accept this kind of texture, that they want real food, they want their rice and chicken and everything. So I ask them to make sure that they eat whatever they like. However, just respect the textures, that it's a little bit softer than usual so that it doesn't cause any kind of injury or trauma into the fresh wound in the throat.
Well, Dr. Abeer, I'm sure a lot of parents are appreciating these advice that you're giving them. But dear viewers, we have more questions for Dr. Abeer after this break.
Dear viewers, we're back again with Dr. Abeer Alali. Dr. Abeer, so we hear a lot about these ear tube procedures done commonly among the children. Can you explain to us exactly the purpose of the ear tube procedures?
So the ear tubes, or sometimes we call them ventilation tubes, is to establish good ventilation in the middle ear. Because a lot of times, or it's not uncommon for kids to develop recurrent middle ear infections or chronic fluid in the middle ear.
Okay.
So it is a very common condition that occurs in kids, especially those who go to, the ages of daycare and whatnot. So, and when we have this kind of fluid in the middle ear that lasts for more than 3 months, then definitely this is an indication for putting the ear tubes or the ventilation tubes, because having fluid in the middle ear will cause the hearing to be impaired. So it's going to reduce their hearing. And we have to keep in mind that kids, especially in this young age, they need to have 100% normal hearing for their language to develop. And, because they go to school, it's going to affect their school performance, their education and development. So we have to make sure that the ears are, well aerated and that there's no fluid. So the procedure is also a very simple procedure, straightforward. It's a day case also, that the patients come in, we do the procedure, and then they can go home on the same day. And we just place the ear tubes. And this allows for the fluid that is trapped in the middle ear to drain. So it creates good ventilation. Other cases where it is not a chronic ear fluid, but repeated infections, because it is not good for a kid to have repeated ear infections as well. And we have a criteria: if there are 3 infections in the past 4 months or 4 infections in the past year, then this means that we need to put ear tubes also to establish ventilation. And most importantly, when the infection occurs, because the tubes, they don't prevent the infection. The tubes are not going to cause that the bacteria will never come again. It's not the case.
Yes.
It's just that when we have the tubes in, we can treat with local antibiotics rather than giving oral or systemic antibiotics. So by that, we can treat the disease locally rather than treating it systematically. So it definitely helps with the immunity of the patients, and we don't develop antibiotic resistance. The other thing is that it reduces the level of pain, and because ear infections are very painful and it's severe, and also the children, they suffer from high temperature. Also, they can get into dehydration because they don't feed, they're tired, they're sick. So it can prevent all of this just by adding the ear tubes.
Wonderful.
Dr. Abeer, what about after the ear tube insertion? What do you think parents should do as post-operative care instructions? Are there any after the surgery?
It is very clear that when we have the ear tubes in place, there is no specific restrictions. And this is also according to the guidelines. Once the kid has the tubes in, I usually say just keep it safe and don't, when they shower or anything, to keep the ears protected for 10 days, just to make sure that the tubes are in place. And after that, they could enjoy their lives, do whatever they want to do, take showers, go swimming. There is absolutely no restrictions. To the contrary, what everybody says.
Okay.
And I keep telling, parents, please keep in mind the well-being of the child is very important. That it's not correct, because let's say now summertime is here and the baby or the kid has ear tubes. It's not easy to keep the ears covered. First of all, it's a burden on the mother. The child will not accept it. And you're preventing a child from having fun in the summer and swimming and enjoying their summer. So we have to think that every advice that we give a parent, first of all, it has to be based on guidelines. The other thing is, and I find it to be very important, is considering the quality of life of the patient. So again, to say no water restrictions or water precautions. However, it is important to follow up with your surgeon every 4 to 6 months, regular checkups, just to make sure that the tubes are in place. Did they fall off? And if they fell, is the ear okay? Is there a perforation from the ear tube? Is it completely closed? So on and so forth. So it's very important to follow up every 4 to 6 months.
Dr. Abeer, choking episodes, especially in newborns, can be very frightening for parents. So what are the most common causes of choking in babies?
It is a very long list of why do babies choke, but I'm going to try to make it simple and summarize it in two, let's say, categories. The first category is inflammation of the airway, and the other category is anatomical anomalies of the airway. So when we have something that is caused by inflammation, meaning gastroesophageal reflux, and this is the most common cause of choking that we see in children, or let's say in newborn babies. We know that it's very common for babies to have gastroesophageal reflux, and that is because still the structure and the esophageal sphincter is not well matured. So we still have a little bit of closure and opening of the sphincter that is not well developed. So they have a tendency to have reflux, okay? And that's why when we have reflux, of course, reflux, there's acid because the contents of the stomach is going all the way up and there's acid in the stomach. So this kind of reflux causes irritation and inflammation of the airway. And we know that the esophagus and the airways, I always say that they're neighbors, separated by a thin wall. So when the esophagus is inflamed, then it affects the airway. So because of this inflammation, it can cause choking. And that is the most common cause of the inflammatory causes that causes choking. The other anatomical issues, which is most common, is laryngomalacia, which is the malacia or the softening of the larynx that can cause choking. The other anatomical issue is what we call the laryngeal cleft. It means that the laryngeal wall, or the wall between the larynx or the airway and the esophagus, there's a little like indentation. So it's not a full thick wall where it protects the food that is going from the mouth all the way to esophagus. But if there's like this sort of indentation between the two walls, it is easy for the food to go from the mouth and just a teeny bit would slip into the airway rather than the esophagus.
Mhm.
And that, of course, is the patient will cough and choke as a protective mechanism, because food is not allowed in the airway. It has to go
Yes.
to the digestive tract. So that is another cause, and it is an anatomical defect, and usually it is treated surgically. And I have to add that all the anatomical defects are treated surgically.
Okay.
Another anatomical defect, which is the tracheoesophageal fistula, which is a thin hole that is between the esophagus and the trachea. So again, this will allow the food to escape from the esophagus all the way to the trachea, and this causes choking as well. And it's pretty severe, the tracheoesophageal fistula, because everything that the patient eats will fall into the airway, and that would cause significant issues, and especially recurrent pneumonia, which is very dangerous.
So out of all those three categories, which one is the most, you mentioned the third one, but when do you think the choking is a hazard, or it's very severe and dangerous to the child and needs medical attention?
I mean, all three, they definitely need medical attention, especially if the patient, as we said, develops recurrent pneumonia, meaning that they're always admitted to the hospital, treated with antibiotics to treat the infection, because again, food is falling into the lungs rather than the stomach.
Yes.
And also because a lot of times the patient doesn't gain weight because they're choking and they're aspirating and the food is falling into the airways, and they're always sick. So it does affect the child's weight gain. Luckily that the tracheoesophageal fistula is pretty rare, and also the laryngeal cleft. They're not as rare as the tracheoesophageal fistula, but again, they're present. But I would say the most common is the laryngomalacia. And again, it does not cause severe choking, but they do choke. They definitely have less complications on the airway, the laryngomalacia with respect to the tracheoesophageal fistula and the laryngeal cleft.
So all kind of, if any situation happens when a newborn is choking, he has to be admitted to a hospital immediately.
Well, not all choking, but of course a choking episode that develops into, cyanosis, meaning that the child turns blue, that there is something that is considered an emergency, then definitely they have to come. A lot of kids choke, not all choking is dangerous, and that is worrisome. But when we have consistent choking with every feed, or a patient is failing to thrive, meaning that they're not gaining weight, that the choking is causing recurrent infections, then this is definitely something that needs medical attention.
So, dear viewers, we're going to take another short break and we'll be back again.
Welcome back, dear viewers. We are still with Dr. Abeer Alali. Dr. Abeer, let's talk about noisy breathing in babies. Sometimes we hear noises when they're breathing, especially during sleep. So when can this be considered normal, and when should parents become worried?
I usually say that any noisy breathing, it's always better to have the parents check. Not everything is dangerous and that we need to, panic about it, but I do recommend that they seek just to make sure that everything is okay. Again, there's a long list for noisy breathing. We can start as simple as nasal obstruction. We can have issues again with, reflux, because there's a lot of secretions, and the children tend to, when there's a wet larynx, then there's definitely some noise when the child breathes. The other thing is, again, we mentioned laryngomalacia, which is a little bit narrowing and softening of the larynx, and therefore the patient does have noisy breathing, especially when they have, their inspiration. There's also soft trachea, what we call tracheomalacia, is also another cause of noisy breathing. So yeah, basically anything that causes turbulence in the airflow would cause noisy breathing in children, and we have to make sure what is this, and again, it's anatomical issues most of the time, so we need to make sure that, what is something that we need to worry about and what is something that we could just, follow on or treat medically.
Dr. Abeer, a final question. What advice would you give parents to monitor and keep their eye on their children's ear, nose, and throat health?
I think this is applicable for any specialization in the medical field. I always say that parents, and especially mothers, they have a gut instinct. And if there is anything that they have any concerns about their children, regardless, I think that they should seek medical advice. I don't have a specific thing because, again, the list is long, but anything that is usually abnormal in terms of the baby's weight, feeding, sleeping, attention, hearing, you know, it could be simple as the mother calls on her child a few times and he doesn't respond, he can't hear. So very, very simple things. And some people might say, you know, they would not think of it as something important, but I'm sure that mothers will notice the difference.
Yes.
So anything that is
itching the ear, fevers.
Exactly.
Yes,
And
yes.
they're very simple things, but they do make a difference, and the mothers do notice the difference, and they realize that. And I advise them that if you see something, especially that if it lasts for a few days, like if it's like a one-day thing, then we should not worry, obviously. But if it's something that is consistent, that stays for some time, then no, definitely we need to make sure that everything is okay and to check on what the issue is.
Thank you.
Well, Dr. Abeer Alali, thank you so much for being with us today and taking your time to being with us here and giving us this valuable information. Thank you so much for being with us today.
Thank you very much.
Thank you, Dr. Abeer. We were honored and we had the pleasure of having you today.
Thank you so much. I appreciate it. Thank you.
Well, dear viewers, this brings us to the end of this interview, but we still have more segment in this episode coming up soon.